Hello, I'm Dr. Charles Frenette. I'm the Medical Director for Infection Control at the MUHC. And first of all, thank you for coming back. Thank you for being patient, as I know you've been waiting a long time to come and see your loved ones. As a Medical Director of Infection Control, I deal exclusively with advising our organization on caring for patients with infectious disease, but also in preventing transmission of these diseases, including COVID, to other patients and to our healthcare workers. In this regard, you will, I'm sure, know by now that our population is extremely vulnerable to COVID-19, and that not knowing a few months ago how extensive this disease was, we took all the necessary precautions up to now, and really being on the safe side to be able to protect our vulnerable population. I will now give you a very short course, basic infection control, that we will ask you to follow very diligently if you come to our hospital. The first thing is, if you plan to come to our hospital, we ask you to wear clean clothes from the day that you will put on and remove once you get at home and wash. Any objects or things that you will bring will be taken from you and put in a locker during your visit. The first thing we will ask you to do is to wash your hands, and we will give you a mask to wear on for the entire time of your visit within our walls. Next, we will be asking you a questionnaire to see if you have any symptoms compatible with COVID. We will also ask you if you had any contacts with people potentially having COVID. Any answer to those questions, particularly if you have symptoms, will lead to your visit being postponed. And if you have symptoms, we will arrange for you to have a test as soon as possible. Depending on the test result, we ask you to stay home if the test is negative for at least 48 hours after the end of symptoms. And if the test is positive, you will have to stay home at least 14 days and after the repeat test is negative. These questions will be asked every day, and we really trust you that you will give us your sincere answer. Now, in terms of infection control measures, 3 things. First, washing your hand. 2, mask. Now, the mask has to cover your nose, your mouth, all the time. We ask you not to touch your mask, or if you touch your mask, you'll have to wash your hand immediately after. It has to be over the nose and mouth, not in your neck, not on your forehead, not hanging by your ears. The second thing we will ask you is to keep a 2-meter distance from any human being. That's what we call social distancing. And that includes your loved one, so that you don't contaminate yourself or he doesn't contaminate you. If healthcare workers need to do some specific care, they might ask you to leave them alone the time being that they complete their care, and you will be asked to stand nearby. You will be accompanied to your loved one's room when you come in and when you move out, and of course visiting hours will be limited. We ask you to remain in the room, not to go to the fridge, not to go to common areas, not to go to nursing station in terms of for picking up any clothings, any cloths or anything. You would rather ask the nursing or the PAB if you need something. Finally, but not least, what you do within our walls is important, But what you do outside of our walls is even more important, because this is where may acquire COVID. So there are a few things you should be very careful when you're at home. The first thing is this social distancing that we are asking you to do within our walls, you have to do at home as well. You should stay 2 meters away of any individual. You should avoid any contact with people who have colds, sore throat, fever, cough, breathing difficulty, so that you don't get contaminated. You should avoid being in a situation where a whole bunch of people are together in close contacts. Suppers, family reunions are really not a good idea in these times where the virus is still quite endemic. Finally, and not least, if you have children going back to school, they are likely to be contaminated, bring this back home, and expose you. If that's the case, we would ask you to avoid coming to our institution in these circumstances. I hope all these consignes are clear to you. If you have any questions, please ask our nursing personnel or our infection control professionals, which are on site and are able to advise if you have any questions. Thank you once again, and I hope you have a pleasant visit.